This is the Berman Method Podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we're rolling, baby, with the Berman Method Podcast. Dr. Jake Berman here with my beautiful co-host,
Jenny Berman, physician assistant.
We are focused on treating problems and not symptoms. We're David going against Goliath. Goliath being the corporate medical system, big pharma, the insurance companies. They will always choose profits over patient outcomes. And there's 99.9% of the time, a different way to do it than what you've been told.
Correct.
So that's what we're all about, is trying to share our best practice acts and to share some thoughts and some ideas and some routes that are not mainstream media, not the things that you see on TV. I just saw another commercial. What was it, last night or the night before? Right before I go to bed. You know, I'm brushing my teeth, watching TV, or just listening to it, not really watching it. And this pharmaceutical drug comes on the commercial. And it was essentially for diarrhea. If you've got chronic diarrhea, take this drug. And what did I come in to the bedroom laughing my head off? Because what was one of the side effects?
Well, I'm pretty sure it said you may die.
It was
right?
brain infection.
Oh, a brain infection. Yeah. And you might die.
So I'm sitting here going, oh my gosh, what is worse, shit in your pants or a brain infection?
Oh, so sad.
I'm going, you've got to be kidding me. There is a chemically composed pharmaceutical drug that's making billions treating the symptom of diarrhea.
Right.
Versus figuring out what the problem is that's causing the diarrhea.
Right. With the side effect of potentially a life-threatening issue of a brain infection.
A freaking brain infection, but it's safe. It's FDA approved.
Right.
That's what cracks me up about this is they can say these side effects, or they have to say these side effects because it actually happened to somebody.
Right. Yes.
Like they don't say a side effect that never happened to somebody.
Right. Right.
Yet the FDA approved this drug that's supposed to fix your ass piss that can cause a brain infection.
Yes.
Come on. Oh my goodness. And that documentary Pain Pill just goes to expose how the door is open both ways, where you work at the FDA and these big pharmaceutical companies with such deep pockets that they can buy anything they want. They're essentially buying people from the FDA to come work for them and be on their board. So, of course, they've got great relationships with people at the FDA. And then they can say, hey, you need to approve this drug. Even though it could cause a brain infection, It's pretty safe overall.
Yeah. Yeah. That's like... It happened to somebody, but that doesn't mean it's going to happen all the time, right? So instead of just figuring out the problem, let's treat the problem of the diarrhea and not have to go on medications long term.
Yes.
But that's hard.
If you haven't watched the show on Netflix, Pain Pill, highly, highly, highly recommend it. Even if you don't have Netflix, spend $25 for 1 month subscription. Watch the watch the show. It's dramatized for Hollywood effects. However, it is as close to factual as you can possibly get. And I've talked to quite a few people since this show's come out that are very on the inside, and they say it was actually tame in that show, meaning that it is way worse than what that show is leading you to believe. So neither here nor there, trying not to catastrophize as much as possible, trying to put as much facts out there. That's what we're trying to do. We're David going against Goliath, the corporate medical system. There is almost always another way than what you've been told by your primary care or your orthopedic surgeon.
That's exactly right. And we say it all the time. Question what they're recommending. Question what they're telling you to do. Question us. I'm teaching a lecture right now up at Nova Southeastern Physician Assistant School, the PA school up there in Fort Myers. And the students are, asking me, well, this isn't what we're taught through Western medicine, because I'm teaching an alternative medicine course. And I said, I know we need to be teaching our patients to question the Western medicine way and understand that there is a different way to treat every diagnosis.
Absolutely. And it just happened to me again last week where I got this new client that found me off Google. He's got elbow pain. And long story short, his elbow pain is coming from his neck, right? 99% of all non-traumatic elbow pain is coming from the neck, coming from poor posture. So I do my assessment, go through, and I'm like, yes, this is exactly what it is. He's worked at a desk for the majority of his life in IT computers, and posture is what's causing his elbow pain. And I say, I'm 100% confident I can help you resolve this. And we agreed to a plan of 5 days a week for the first few weeks because we're doing a complete makeover, a complete remodel of his posture primarily, and the elbow would be secondary to it. So he goes back and he tells his elbow specialist, the orthopedic surgeon who specializes in elbows, that he's going to PT and he's seeing us 5 days a week. Oh, and the icing on the cake is that we were going to do shockwave to him too, once a week for 6 weeks to the elbow. And the specialist says, that's too much. You should only be going 3 days a week. And I don't want you to do shockwave. And I'm going, are you freaking kidding me?
Mm-hmm.
And of course, my client takes his word over mine because he's the expert. He's the doctor that specializes in elbows. And I'm going, I'm scratching my head here going, this guy specializes in the scalpel.
Mm-hmm. Surgery.
He specializes in surgical conditions of the elbow. He does not specialize in helping you avoid surgery, and he damn sure does not specialize in rehab.
Right.
I'm the one that specializes in that. That is my expertise. And if I say somebody should come in 5 days a week because they will really benefit from it, then that's what it needs to do, and he should do, because it was a total body makeover. It wasn't a rehab thing. It was, let's get the body moving. And I always equate this to, how many days a week do you work out?
Right.
Jenny, how many days a week do you work out?
6.
Really?
Ish. 7.
7. You work out
Most days,
7 days a week.
Or weeks.
Right? You work out 7 days a week. I work out 6 days a week. A lot of people work out 5 days a week.
Mm-hmm.
Why do we work out 5, 6, 7 days a week? Why?
Consistency.
To maintain and progress things.
Right.
So why do we think that it's okay to only do something 3 days a week if we're talking about rehab? Or it's not even acute rehab. So don't get me wrong here. If there's an acute injury and there's actual soft tissue damage, then yes, you do have to follow the protocols and there must be some time of rest. But if we're not creating DOMS, delayed onset muscle soreness, because we've done 100 squats and there's no soft tissue injury, there's no reason at all why we cannot do 5 days a week. Specifically when we're not even targeting the elbow, we're targeting posture.
Right. And that's what I was going to bring up is that you're not working on the elbow 5 days a week. You're working on his neck one day. You're working on the shoulders one day. You're working on core activation one day. You're doing something different every day, targeting essentially different muscle groups across the 5 days, which is all going to improve the elbow pain in the weeks to come.
Exactly. And here was the icing on the cake. The elbow specialist also said, I don't want you to do shockwave.
Right.
And I'm going, are you effing kidding me?
Do you even know what shockwave is?
That was number one. First of all, do you even know what shockwave is? And second of all, do you understand that shockwave is literally the only modality in its class that has 0 side effects?
Right.
And actual evidence-based research to back it up that it actually is effective.
Right, right. And it's not manipulating in any way. It's not stem therapy, which is probably what he was thinking, like an e-stem. Yeah.
So anyways, this is the stuff that we're talking about every single week, where Western medicine is stuck in this thought process, and they're stuck in that thought process because that's all that insurance will reimburse for. So they're not going to go outside of that realm of thought. They're just not.
Right, right.
So here we are down this rabbit hole rant, and we're not even talking about what we originally wanted to talk about today, which is a very common thing. But let's switch gears.
Okay. Let's say, do we still want to switch gears? Okay.
Yes. Osteoporosis, osteopenia, really, really big problem in America, and it does not have to be, right?
For sure. For sure. And this is one of those diagnoses too, is we often find out about it too late because we don't get our first bone density until we're 60 plus. And by then we've already made it to the osteopenia and sometimes already to the osteoporosis category. So if we break it down first, osteopenia is a decrease of bone density, right? So we have osteopenia first before we actually have osteoporosis. Osteoporosis putting us at higher risk for fracture.
Yes. So to make it as simple as possible, you do not want low density in your bones. It's that simple.
Right. So the reason being is, the first thing everybody thinks about is if I have osteopenia or osteoporosis, I'm at higher risk for a fracture, right? If I fall or if I step off the curb wrong, if I land hard on my bum into a chair, things like that you're going to automatically have a fracture. And that is concerning because as we age, the fractures actually increase our risk of mortality. We have a higher chance of dying once we get a fracture after the age of 60. And so that is something that's important, but there's also many other side effects that come along with osteoporosis, including the side effects that come with the mainstream medications that Western medicine will tell you to start taking for osteoporosis and osteopenia.
One thing that nobody seems to talk about explicitly is how highly correlated osteopenia, osteoporosis is with muscle loss, weakness, right?
Right. Yeah, it absolutely is. There's a correlation for sure between these things as well as some other factors, risk factors that we're going to talk about that increase your risk for osteopenia and osteoporosis. But certainly we've talked about before on this podcast that we lose muscle mass as we age. Starting at the age of 30, if we're not getting adequate protein and adequate strength training, we will start to lose 1% of our muscle mass per year. And so absolutely, as we reduce muscle mass through the aging process, that certainly increases our risk of osteopenia and osteoporosis.
Said differently, this is a big generality, so this is not always true. This is just true a lot of the time. Whenever you see somebody that has osteoporosis, it is very rare that they have a ton of muscle mass, which means it is very rare that that same person is very mobile, very active, maintaining a very high quality of life because they're not mobile. They're usually shuffling around. They're usually linear, going from point A to point B. A lot of time in recliners. They're not really active.
Right. And that's a huge problem, and especially when you see a Western medicine doctor and they tell you that you have osteoporosis and osteopenia, they've diagnosed you with this. The first things they're going to talk about is your vitamin D optimal? Is your calcium level optimal? So certainly those are the first things we think of a vitamin D replacement, calcium replacement, and then weight-bearing activity. Those are the three basics that we start with when we are developing this diagnosis. Weight-bearing activity meaning getting up and moving on your feet, actually doing exercise with your own body weight or with added weight. So swimming in a pool doesn't count. Swimming in a pool does not help our bone density.
Walking does not count because the vast majority of people that have osteopenia or osteoporosis are not walking efficiently. You're doing controlled falling. So it doesn't even count as a weight-bearing activity, even though you are fighting gravity. It doesn't count if you walk 10 miles a day. It doesn't help.
Right. And that's where we'll talk with our clients about how important strength training is. This is a conversation we're having all the time is even if it's 2-pound weights, that you're doing something with controlled exercise with this 2 to 3 pound weights. But the other thing we'll recommend is for our clients who really do enjoy walking and they walk long distances, put ankle weights on your ankles, put wrist weights on your wrists and start walking with added weight. Wear a weight belt, wear a weight vest. So add some weight when you're walking and making sure you're doing it with the appropriate form as well.
Oh my gosh, that just sounds like too much work. I'm not doing that.
A lot of our clients actually do it. They will go and they'll Amazon in some wrist and ankle weights and start walking with that. And my recommendation is don't walk as far or as long because you're going to have this added weight. Start back a little bit, but making sure obviously that form with walking is appropriate.
Good. One little blue light special that I like to talk about is it's as clear as day when I say this. If you have osteoporosis is worse than osteopenia, right? That means you're at high risk for bone fractures. It is almost impossible that you are able to get down on the ground, lay flat on your chest, get back up again 10 times in a row.
Right.
Like
Right.
I don't know that I've ever seen anybody diagnosed with osteoporosis who could get down on the ground, lay on their chest, get back up again 10 times in a row. Now, when you hear that in words, you're thinking, oh, that doesn't seem like that hard. Go and do it right now. Press pause on the podcast right now and go do it.
Right.
See if you can do it 10 times right now. If you can, that's great. Pretty sure you don't have osteoporosis.
Right. And that's the risk factor behind it is that you don't have the strength to be able to control yourself down to the ground and control yourself back up, which is what puts us at higher risk factor for fracture as well. But I wanted to talk about some other risk factors. So we've already mentioned the vitamin D deficiency, calcium deficiency, not getting enough weight-bearing exercise, poor strength of muscle mass. But also, there's some longer-term issues that can increase our risk later on for osteoporosis, osteopenia. So for instance, not having a menstrual cycle for 6 months or more in a female. So those who have gone through amenorrhea meaning they don't have a menstrual cycle for various reasons, whether it's a decreased body mass index or a secondary issue with infertility, or even women who are excessive exercisers, which can certainly inhibit them from having a menstrual cycle. So those women who do not have a menstrual cycle for 6 months or more at any time in their life can actually increase their risk factor of osteoporosis as well. Fair complexion, so fair-skinned individuals, thin bone structure, so just naturally have thinner bones that not that the individual is thin, but thinner bone structure. High-fat diets, so all these individuals interested in the keto diet, watch what you're doing. Having a high-fat diet can also increase the risk. Soft drinks, so soda, definitely. Caffeine actually increases calcium loss. So those of us drinking 2 and 3 cups of coffee a day, plus having your sodas, this definitely is a risk factor. If you're drinking 3 cups of coffee per day, you're losing about 45 milligrams of calcium per day. So think about that over years and years and years. You're chronically losing calcium. Certainly medication, so steroids is a big one. Steroids definitely will lead to osteopenia and osteoporosis, especially if you're taking them long term. Having hyperthyroidism, so taking too much of your thyroid medicine and keeping you into a hyperthyroid state can certainly be a problem. This is one of my favorite medications out there.
Ooh, weed?
Reflux medications, PPIs, antacid, so pantoprazole, omeprazole, Pepcid, Zantac, these medications that help with your heartburn and your reflux. We've already talked about tons and tons of times how they can cause vitamin deficiencies like B12 and magnesium, can interfere with other medications, but they also lead to calcium loss and bone density issues.
You mean that little tiny pill that I brainlessly take every single day for my reflux
That's it.
could lead to me being osteoporotic?
Yes.
What?
Yes.
But
and nobody wants to believe it.
Yeah, I thought there was no harm in this thing. I thought it was just little tiny magic pill that didn't cause brain infections or anything.
I know. I had a patient just last week who went for an endoscopy and colonoscopy, just routine. And his doctor saw that he had some gastritis. And we've been working on his gut health for several weeks, although we're struggling with consistency of compliance. But regardless, we're working on it. And they saw gastritis, which is inflammation of the gastric, of the stomach. And they told him to start Pepcid twice a day, every day. And I said, "Are you having heartburn?" "No, I'm not having heartburn." So you're not having heartburn, you're not symptomatic, and they're telling you to take Pepcid twice a day, every day, because they saw inflammation of your stomach. Got it. Okay. Do they understand the side effects that this Pepcid is causing while we're also working on your gut healing? It was just crazy to think about.
This is exactly what we're talking about. This is what the podcast is all about. The stomach being inflamed is a symptom of something else going on. Yet the doctor, right, the expert, I'm doing air quotes right now, the expert says, take this chemically composed pharmaceutical medication twice a day for the unforeseen future, and that's going to help fix this problem.
And by the way, he's a 74-year-old male who's already at higher risk for osteoporosis, right? Just because of age. And also he has some other comorbidities that are going to increase the risk factor. So now we're going to add to that by putting you on a medication twice a day.
You have to start taking your health in your own hands. Just because you go to a doctor that is covered by your insurance and they tell you something, it doesn't mean that that's what you should be doing. What we say doesn't mean what you should be doing. Just question it.
Right. Right. So one more thing that I'm going to talk about, and then we'll jump into some foods that can help with osteoporosis or hurt. So high cortisol levels can also increase the risk of osteoporosis and osteopenia. Cortisol is a steroid. So that comes back to steroids actually reducing the body's ability to absorb calcium. So all of those with chronic stress for one reason or another, whether it's internal or external stress, remember that food sensitivities and poor gut health is an internal stressor on the body that you may not feel, that's actually causing cortisol elevation and blood sugar instability, leading to this osteoporosis. So I mentioned that caffeine can reduce calcium absorption, but there are some other foods that can decrease calcium absorption as well, which is going to put you at higher risk for osteoporosis. Those including high fiber cereals, especially the wheat-based cereals. So we think about cereal like Cheerios and oatmeal being so healthy for us in our gut, but it's not about that at all. I mean, that's what's posted on the television, but it's not giving us the whole picture of what these cereals actually contain and what they're actually doing to our body.
It's the first time I've heard the word television said out in full in a while. I was like, what the heck is a television? Oh, the TV.
Okay, going on. Diet high in breads, whole wheat, Swiss chard, and we already talked about high-fat diets, cocoa and chocolate. All of these things can reduce calcium absorption. But then I'm going to send you guys off with some foods high in calcium, rich in calcium, that can actually help with proper absorption to preventing osteoporosis and osteopenia.
Whole milk.
No. But you think that would help because that has calcium and vitamin D in it, right?
That's what everybody thinks. Oh, I'm getting osteoporotic. I need to drink more milk.
And that's what clients will ask us all the time when they're on the dairy-free meal plan. Do I need to be taking calcium? And I'm like, no, you're getting calcium through plenty of other foods, even if you're consuming a dairy-free meal plan, that you don't need to take calcium supplementation. Calcium supplementation is important for some people. And by the way, your doctor tells you to take 1,200 milligrams of calcium. What they don't tell you is that you can only absorb 600 milligrams at a time.
What? Are you freaking kidding me?
The most common dosage for calcium supplementation is 1,200 milligrams.
Why in the world would they ever prescribe double what you're actually capable of absorbing? Why?
Because they don't take the time to tell you that you should be taking 600 milligrams 2 times a day.
That took an entire 7 more seconds.
Yeah. Right.
That's how bad this is getting people. They don't have 7 extra seconds to tell you to take 600 milligrams twice a day. So they just say 1,200 milligrams once a day.
Right. They're like, you need 1,200 milligrams of calcium per day. That's how they tell you. Okay. So people go out and take 1,200 milligrams. What they don't realize is that this should be 600 milligrams twice a day.
Oh my goodness.
So, the other big factor with osteoporosis, osteopenia, and calcium absorption is that your gut is healthy. So this should be the first step that you're looking into is why am I not absorbing calcium in the first place? Why is my gut not healthy enough to absorb calcium? So that's always the first step. We've already talked about how whole wheat can reduce calcium absorption. So majority of the time we're looking at avoiding wheat and wheat products. So a gluten-free diet is recommended for those with osteopenia, osteoporosis. But I'm going to leave you with some other foods that are high in calcium. These are not the only ones, so please don't take away that this is the only food you can eat, but just some good ones that I liked that I'm going to leave you with. So we have kelp, almonds, shrimp, parsley, Brazil nuts, tofu, garbanzo beans, walnuts, pecans, white beans, black beans, broccoli, yogurt, eggs. Nobody likes eggs, right? Eggs are bad for us. They're high in cholesterol. That's a terrible thing. Don't ever believe that when people tell you that eggs are high in cholesterol. So eggs are actually great for osteoporosis and osteopenia and for many other reasons, including cardiovascular disease. Bluefish, salmon, halibut, chicken, ground beef. Animal protein is not bad, y'all. That's where I'm leaving it. So, lots of foods out there that can help us with absorbing calcium, but our gut has to be healthy. If you're taking calcium supplementation, split it up 600 milligrams twice a day. Get in your weight-bearing exercise, not walking and not swimming.
Do the test. See if you could literally get down on the ground, lay flat on your stomach, and get back up again 10 times. If you can, time it. Then see if you can do it in less time 1 week from today.
I think that's a good idea. That's essentially like 10 burpees, but...
It is.
Yeah. But we're saying it nicer. Just lay down and get back up.
And I'm not telling you to jump or do a push-up.
Yeah, no push-ups, no jumping.
Yeah. Also, you mentioned eggs. Eggs are very controversial. I think that we should do that maybe for the next topic is talk about eggs and cholesterol, the difference between good cholesterol, bad cholesterol, how important cholesterol is for getting nutrients across the blood-brain barrier.
Right.
I mean, we could talk a lot about all of these misconceptions regarding cholesterol and specifically eggs.
Right. Agreed.
Good?
Yeah.
All right. So we talked a lot. We had a 10-minute rant. We actually have the kids up here today. So we're going to go get Stella and see if she is microphone shy. She wanted to give a shout out when we first started. We'll see. Come on. Let's go. Come on. You can do it.
What are you going to say? Talking to the microphone.
We got Vera here too. Say something, Vera. That's Stella.
Say hi.
You can't be shy. If you're going to say something, don't
waste their time.
Yeah, don't be intimidated. There's only millions of people listening right now.
Tell Daddy what you were doing.
playing with the baby dolls.
Can you say it louder? Come on.
Talk like big girl.
Say it again.
Playing with the baby dolls.
So you were playing with the baby dolls, and Vera was being good too?
What was your baby's name today?
Oh my gosh, camera shy.
Oh,
We'll work on this.
You wanted to talk.
We're working on a star. A star is being born right now.
Is it Penelope? Say yeah. Penelope?
Yeah.
Penelope.
Okay, the baby doll's name was Penelope.
Okay.
All right.
Say ciao for now.
Ciao for now.
Ciao for now. All right. Thanks for listening. Like, subscribe, share this with somebody, especially the rant at the beginning. I think that was a good rant that I had today. I'm going to go ahead and give that rant an A+.
I think it was a good one.
And Shockwave is not bad.
Shockwave is not bad.
It's actually really, really good.
Eggs are not bad. Shockwave is not bad.
Yeah. Osteoporosis is bad.
Yeah.
Taking calcium, 1,200 milligrams of calcium at once. Oh, now Vera wants to talk.
She's calling you Stella.
Okay, that's good.
Ciao for now.
See ya.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.